Hello, my name is Sophia, and welcome to my presentation on the Bhopal disaster, focusing on its environmental and human health impacts. Today, I'll walk you through a series of graphs, tables, and maps that tell the story of this catastrophic event and its lasting legacy. In this presentation, my objectives are to introduce the historical context of the Bhopal MIC gas disaster, present key environmental and public health data related to the incident, examine temporal trends in contamination and health outcomes, and to highlight ongoing remedies and lessons learned. So first, we'll review a spatial distribution map of Bhopal, highlighting the worst affected neighborhoods, then a table of the environmental contamination metrics, followed by a bar graph on health statistics and socioeconomic impact, and finally a pie chart breaking down the victim categories, concluded by the summary and some references. So this is Bhopal's map, and it highlights the worst affected neighborhoods. It clearly indicates that communities closest to the Union Carbide plant bore the brunt of the toxic exposure, and this legacy still persists today. On this slide, we have a temporal graph that beautifully captures the trend of spontaneous abortion rates from late 1984 through 1989 across 4 different exposure groups. As you can see, the severely affected areas experienced the highest rates immediately following the disaster, with the numbers gradually declining over time. However, even as the rates drop, they consistently remain higher than those observed in the control areas. This chart uses data from the Indian Council of Medical Research and is cited in July 2010 in the OEHHA report on methyl isocyanate. We plot the year on the x-axis, and the spontaneous abortion rate is expressed as a percentage on the y-axis. Each line represents a distinct exposure group, severely, moderately, and mildly affected, alongside the control group. The narrative here is clear. Immediately after the gas leak, women in the severely affected areas faced alarmingly high rates of pregnancy loss, as a trend that echoes findings across multiple studies reporting elevated first trimester spontaneous abortions and neonatal mortality. These patterns provide strong evidence of both acute and lingering reproductive health impacts linked to MIC exposure, underscoring an overall adverse reproductive effect in the affected communities. On this slide, we see a table that captures mercury concentrations in groundwater samples collected during the post-monsoon period of 2001. The table extracted from the groundwater contamination near the Union Carbide India Ltd plant at Bhopal report presents data from various sampling sites, including details like the source type, depth, and mercury levels measured in micrograms per liter. Notice how some sites such as Rizaldar Colony, Rajenjar Nagar, and Green Park Colony show not detected levels, while others like Arif Nagar register significantly higher concentrations, peaking at 70 per liter. This variation vividly illustrates the spatial extent of contamination around the plant and underscores the long-term environmental exposure risks faced by local communities. Now we can turn our attention to this bar graph, which encapsulates the key health and socioeconomic impacts of Bhopal disaster. Adapted from the Amnesty International report, Clouds of Injustice, a Bhopal Disaster 20 Years On, the graph lays out a stark picture by comparing several critical figures. More than 7,000 immediate fatalities in the first few days following the leak, at least 15,000 additional deaths over the ensuing 2 decades due to the gas-related illnesses, and over 100,000 people still battling chronic, debilitating illnesses today. Moreover, the settlement estimates of 105,000 victims, which includes various categories such as disabilities and injuries, further underscores the enormity of the tragedy. The visual contrast in these numbers not only highlights the immense human cost, but also the enduring challenges faced by survivors. This graph vividly illustrates how the disaster's impacts have evolved from the initial shock of mass fatalities to the prolonged suffering experienced by affected communities. And it serves as a powerful reminder of the long-lasting repercussions of industrial disasters on public health and the socioeconomic fabric of the community. To further encapsulate this impact, this pie chart provides a visual breakdown of the victim categories used in the settlement estimates. You can see how the total estimated 105,000 victims are distributed among immediate fatalities, permanent disabilities, temporary disabilities, serious injuries, and minor injuries. This breakdown helps emphasize the multifaceted nature of the disaster's human toll. In summary, the Bhopal disaster is not just a historical event, it's an ongoing environmental and public health crisis. My presentation covered the timeline of the MIC leak, the spatial distribution of contamination, environmental data on mercury levels, and detailed the long-term health and socioeconomic impacts. Together, these data paint a comprehensive picture of the tragedy and underline the urgency for remediation and justice. Thank you so much. Here are my references, and I welcome any questions you may have.